Welcome to the CP Achieve webinar series. My name's Dawn Pickering and I'm calling today from the UK, where it's early morning, whereas it's the end of the working day for you, I know. We encourage people to write questions directly into the chat so we can answer these at the end of the session and also ask questions in the Q&A at the end. To start with, I'd like to acknowledge the traditional custodians of the land on which we meet today and pay our respects to the elders past and present. We extend our respect to the Aboriginal or Torres Strait Islander colleagues and guests who are present today. You are all welcome. So I'm going to put onto my slideshow and off we go. So thank you so much for this opportunity to talk to you about my PhD research. It's going to be a bit of a whistle-top tour today about my methods. I'd like to acknowledge my funders, who are the Chartered Society of Physiotherapy in the UK. So my aim at the beginning of the PhD was to do research with children and young people with cerebral palsy, not on them. And I was influenced by some social science researchers, Tilly Curran and Catherine Runswick-Cole, who published their work in 2013 and 14. The gap in the literature when I looked at this was about the children and young people who cannot walk or talk. There were less choices for participation in recreational activities for them, and little was known about their well-being. My research question was, how do children and young people with cerebral palsy and their parents view, experience and choose their level of participation in recreational activities to benefit their well-being? The problem was finding a suitable method to be able to position the children's voices at the centre of this inquiry. And my PhD study was abbreviated to VOCAL. This is illustrated here for you, which my daughter illustrated. Here you can see this picture, which represents a ramp with various activities that the participants spoke about, which included adapted cycling, surfing, skiing, musical events and race running. All of these were made easier if there was access to a changing places toilet and a mobile hoist. And the logo you see here in the O letter is the logo for the Changing Places campaign, which is part of a big organisation in the UK trying to improve facilities for changing place toilets in public spaces. So when I was thinking about a qualitative design, Creswell suggests choosing from 5 approaches. Firstly, narrative storytelling. And I really liked this idea. But when I was thinking about including children who were non-verbal, I felt it would have limitations in the vocabulary that we could use. I also thought about phenomenology, and I almost did this. But when I looked into it, where I had to give the data back to my participants and get them to comment on it, I felt it wasn't going to be realistic to achieve this. And grounded theory is something that produces a new theory where little is known. And I think we did know already quite a lot about participation, so I didn't feel grounded theory was appropriate. Again, ethnographic would have been interesting to get alongside with participants, but that would have been very invasive of their privacy to join in everything they did in a recreational activity. So I finally decided on using a case study design, which gave me the opportunity to look at the how and why of a situation. I also considered emancipatory approaches, and Barton and Hayhoe outlined that the emancipatory research seeks to transform the power to the individuals by seeking to empower them at all stages of the research process, from design to dissemination. However, Maitiola had critiqued that current emancipatory research did not include those without a physical voice, which was going to be a limitation for my study. Therefore, I wasn't really able to use this in its fullest sense. So looking at case study design, Yin proposes that there are 6 sources which can provide evidence to make up each case. These are documentation, archival records, interviews, direct observations, participant observation, and physical artifacts. I felt that the case study offered a way to compare the different levels of participation and how this affected the well-being of the participants. So each case comprised of 2 interviews using photographs and diaries to elicit discussion, supported by observations. These observations provided the evidence of well-being indicators that were interpreted by the researcher in tandem with the parents. There was no obvious archival records that were relevant for my study. I therefore didn't use that. But I chose to use engaging in sandbox activities with toys to represent their choice of activities, as well as engaging with eye gaze and augmentative and alternative communication. And it's enabled me to create a unique depth of data generation. This triangulation of the different data sources, which made up each case, enhanced the trustworthiness in my study. So here you can just see a flow diagram here. The data collection started with an interview. The diary was kept for 12 weeks. I went out and did some observations during that time where I took some photographs, but the parents also sent me photographs and put these into the diary. And this helped me with the second interview where the diary and the photographs were used to have a discussion, like a photo elicited discussion about their participation. Gaining consent for any research usually involves the participant's signature on a consent form. And Alderson and Morrow have proposed that depending on the age and cognitive ability, the children themselves can give consent under the age of 16, which is termed Gillick competency. However, when I was considering vulnerable populations, such as those with communication and learning disabilities, it was not straightforward, and the concept of assent was introduced. And Alderson and Morrow suggest that assent can mean that children understand some, but not all of the main issues required for consent. And it can mean at least not refusing. However, Emma Reynolds at Cardiff University have proposed that assent is an ongoing process and it should not be taken for granted. And that was helpful for me because at every point in the data collection, the children's indicative behaviours were part of this assent process, and they were revisited at every research contact to ensure they were happy with my intent to interview, take photographs or observe them. So those who used the augmentative and alternative communication or eye gaze technology were included in the study, but they always had support from a familiar adult who explained the study to them and introduced me to them. My first visit contact took place in their home and enabled me to understand what their interests were. And this informed the first interview questions as a way of getting to know them. A case study has strengths and limitations, and Flyberg suggests that a good case study enables the research to get close to the reality of their participants, to explore the viewpoints and behaviours and characterise them as social actors. A case study provides an authentic and credible method which may not be generalisable to other populations due to the small sample size, but provides depth, not breadth. The transferability of creative methods within a case study to other non-verbal populations shows potential, but that has yet to be fully realised. So in terms of my own data collection, I had quite a long lead-in period after I've achieved ethical approval before I could register for my PhD. So I actually did some consultation and pilot data to help inform the study and help me decide on the inclusion and exclusion criteria. So I explored using sandbox play, diaries and collages, which is work proposed by Dawn Manet at Cardiff University. And the pilot cases enabled me to narrow down my inclusion criteria to those aged 9 to 16 years and levels 3 to 5 of both the gross motor function classification system and the communication functional classification system. Altogether, I had 7 participants who took part in my vocal study, 4 who participated regularly and 3 whose participation was limited. So here you can see a table of my 7 participants. So they ranged from age 9, 14 and 16. You don't always have a choice of who participates in your study, so they just happen to be clustered in those age groups. So there were 3 females and 4 males. Now, Poppy is a female name, but the family chose to use that. That was the pseudonym that they chose. So it can be a bit confusing when I talk about Poppy as a he. And you can see the different representations of the type of cerebral palsy, the varying muscle tone, and their different levels of gross motor and communication function classification. So there were 2 children who used communication aids who could verbally produce a sound, which was Clare and Lily May, and Poppy used eye gaze technology, but he was at quite an early stage of learning to use this, and it wasn't 100% reliable. But Clare and Lily May did participate with some conversation. So this is some evidence of some pilot data that I collected, and I've published these in a book, which I'll refer to a bit later on. And at the end, I've put a YouTube link to an audio version of a children's book that we produced, where some of these illustrations that you can see used here in the puppet theatre and the sandbox were used. So Becky chose to tell me her story of all the things that she liked doing. So you can see in the sandbox, we've got horse riding, we've got Peppa Pig, who's a British sort of character. I don't know if that translates to Australia as well, but he's on a little trike. And then you've got people having a tea party, which was Becky's ambition in the future, that she was going to open a tea shop and offer tea and cake to people, to chat to them, to encourage them. She was very empathic, Becky, even though at the time she was only about age 9. So that was some of the pilot data. Oh, I don't know what I've done there. Okay, so then I did some collages with young adults with a learning disability, and I asked them to put together, from cutting out pictures or drawing, about what their future ambitions for recreational activities were. So at the top you can see Jugs and Angelica, who both did their collages themselves and wrote about the different things that were important to them. Jug was very much into sport. He was a disability sports ambassador and into swimming, traveling, and his ambition was to coach other disabled young people. And then Angelica, she did do some activities, but not as many physical activities as Jugs, but she very much wanted to go on nice holidays, swim with dolphins, get married and have a baby, which was lovely to see her ambitions. And then Dora, whose picture is at the bottom, what was interesting for me was that Dora was the only person in that group who had a physical disability. So she had cerebral palsy as well as a learning disability. So her carer had to do those drawings for her. And that made me reflect upon how difficult it might be for some children with cerebral palsy to actually produce a collage. So although it was a creative idea, it did have limitations. So I didn't actually use it in the main data collection. I did use the drawings, which we created again from the children's storybook, and it was put onto a laminated sheet. And you can see there that Claire chose to draw a picture of a guitar. She was very musical, like creating and composing music, and she chose to do that on Natalie's picture. So I asked the children to draw on there, or write, if they could write, what the child or young person would like to do to relax and play. But again, this had limitations for the children with cerebral palsy if they couldn't use a pen or a pen on a laminated sheet. So it was limited, and only Clare and Lily May were able to do that. Here we can see Claire's grid for the iPad to show her participation choices. She had pressed on something there which is blocked out, but she had her bike below it. To the right under her thumb is something called Beams, which again is a musical toy that she showed me during the interviews and composed lots of different tunes for me. So this was her screen that would speak, and that was captured on audio in the interviews. Here we can see Poppy's eye gaze choices. So he had a lot of activities at home that he could choose from. So you could see there, he could choose from going on a swing, on a pool, a slide, a trampoline, a hot tub, or his big pool. Poppy didn't do very much outside the home, but these were his choices that he had in the garden at home. And then Lily May had the iPad Go Talk, and you can see there the choices that she had for the recreational activities, which was things like rebounders, skiing, horse riding. Vision 21 was a sort of sensory-based activity. And then Popsy was a community group. And Whiz Kids is a charity in the UK that supports children and young people by providing money for wheelchairs or for trikes. And Lily May became an ambassador for Whiz Kids. So that was really lovely to hear about that in the interviews. And so from the initial meeting, I was able to select toys to help the conversation. So Lily May liked a character called Lalaloopsy. I don't know if that, again, that translates to Australia, but I was able to find some toys that did trampolining and trike riding. And Lily May loved playing with those in the sandbox. The downside for her was that any speech she had was really hindered when she was using her hands for fine motor activities, because it made her drool a lot and it wasn't easy to understand or hear what she could say. But she really enjoyed the sort of playing with the toys as if it was her playing on the trampoline and the trike. So it was difficult data to capture because I didn't video it. It was only an audio recording. So I had to write really good field notes to help me with that. And then this is a picture of James from my field notes. James was gastrostomy fed to maintain his body weight. And it was interesting to see when observing him at the summer play scheme that he was fed outside. This would be unusual to see in a normal park, but in this space, there were several families doing the same and no one seemed bothered by this. And previously his mother said they'd been stared at in the local park when she had done this. So this is an example of a photograph I took of Matthew when he was skiing. And this is just to give you an idea of how I did the analysis, that I would annotate each photograph with what was relevant to my research question and aims. And I was looking for the emotional well-being responses from the children's participation, but including siblings was really important, and also having skilled volunteers who could support the activity. So with Bree, her mother wrote the diary as if Bree was writing it to me, and the diaries added real value when the participants could not speak about their own well-being. So during the study, Bree was one of the children who started out with very limited participation, but they went off and had an assessment for the Tomcat trike. And you can see from her quote there that she was assessed for it, and that was the book I was referring to. In the afternoon, they went cycling. She rode the Tomcat trike and she had a brilliant time. And then after school, they actually, at this after school club she went to, the cycling centre brought the Tomcat trike and she had lots of fun encouraging the staff to make her go faster. This is a picture of Poppy, who went to a farm in his usual wheelchair. And you can see here he wasn't able to get in the back crawl. So that was a hindrance to participation really for Poppy. That was difficult for him. And then Nick was one of the children who did race running. And this was from my observational field notes. So Nick was getting ready to go on the race runner, and Dad had to take these spinners off him to get him on there. And then I was walking round the athletic track with him while Dad was carrying on spinning the spinners, and then I was just chatting to him. What was interesting about Nick, that as I observed him over 3 different occasions, that sometimes he would go round several times a lap round this athletics track, but then other times he wasn't always so keen. So, but it was very interesting to get to see how much he chose to participate or not. So what was really important was the partnership of working with the parents to ensure that my correct interpretation of the children's intentional behaviours from my observation. So this was achieved through member checking by going back to the parents and then perhaps showing the photograph to the children and saying, you know, is this what you meant? And then I chose to position my research within positioning theory. And I haven't got time to go into that here, just to give you a flavour. I identified 3 themes from my data: participation enhancers, champions for disabled children and young people's well-being, and hindrances to participation. And the key results included that the children could be their own advocates by choosing their level of participation, sometimes choosing not to participate to manage their own well-being. So as I said, it was positioned within positioning. The data was positioned within positioning theory. And this is an illustration of how I represented the data in a kaleidoscope of well-being, with advocacy and self-advocacy being central to the children's storylines. So the adapted equipment and environments, the people who were agents of change, sometimes the children themselves, sometimes other people who were advocates for them. People's attitudes and skills were very important, as well as personal environmental limitations. And the children's non-verbal wellbeing responses were able to tell me what their storyline was. However, when things didn't work out, as we saw for Poppy, when he couldn't get into the back crawl, the kaleidoscope was skewed and the colours were not so vibrant. The well-being effect was diminished and wasn't able to work out. It was hard to tell if the children were really aware of this. The parents obviously aware whether children couldn't participate or people's attitudes didn't include them and made them feel not wanted. So my closing slide is to acknowledge the CP Achieve, and please email the email address there if you'd like to inquire about any of the information today, future podcasts, or about presenting webinars, previous editions of the newsletter, participating, registering interest, or anything else. And you can follow CP Achieve on Instagram, Twitter, and Facebook. And it is funded by the National Health and Medical Research Council. And here is the link to the website. Here are my references. I'd like to acknowledge my 3 supervisors, and there is the YouTube link to my audiobook.